The Children's Cancer Hospital Egypt 57357 is one of the most stunning examples of what can be achieved when people work together for the common good of their community and world. The people of Egypt have worked together since the inception of the idea of building a state-of-the-art children's cancer hospital to achieve the dream of a better tomorrow for our children, who, compared with the 75 to 80% survival rates in the West, have less than a 40% chance of being cured from their disease because of lack of adequate facilities, treatment, and expertise of all levels. In 1998, a dedicated group of Egyptian pediatric oncologists, businessmen, and philanthropists established the Association of Friends of the National Cancer Institute, a non-governmental organization, to build the largest children's cancer hospital in Egypt, the Middle East, and Africa, and to build and sustain it completely by donation. Her Excellency, Mrs. Suzanne Mubarak, began the process of funding, planning, design, implementation, and construction with the groundbreaking ceremony in 1999.
الكلام حقيقة يعني صعب حتى الواحد يقدر يلاقي كلام يعبر عن فرحته وسعادته بهذا الإنجاز. احنا النهارده بنبني هرم. أنا بقول هرم خامس لأن بقول احنا بنينا مكتبة اسكندرية وقلنا عليها هرم رابع. النهارده ده الهرم الخامس.
The hospital developed an encompassing mission that would provide free state-of-the-art care for all children with cancer, regardless of race, creed, or ability to pay, and one that would endeavor, with the help of its highly trained staff and international collaboration, to develop effective management and treatment systems that would be a model in the developing world and a model of a philanthropically viable organization. Situated in front of the 15th century aqueducts built by visionary Muhammad Ali Pasha, the futuristic design with the Egyptian sails symbolized a new era in healthcare while respecting Egypt's rich culture and architectural history. The design concept of form-following function was utilized so that the design would be user-friendly for patients and staff and would be responsive to patient care, education, and research needs for the coming decades. The interior theme, widely utilizing natural light throughout and the selective use of color, is intended to make the hospital an appealing place for children who will feel a sense of hope, security, and a loving atmosphere. In compliance with the benchmark standards for pediatric oncology care, the patient rooms are single or semi-private to reduce the risk of infection for our immunocompromised patients. The circular bed tower design ensures closer observation of the patient, improving the workflow for the staff, as well as allowing grouping of patients for isolation requirements, specific disease, or age. The guidelines for children's hospital design have been incorporated, ensuring a functional and family-centered environment. CCHE also meets the recommended international standards for a pediatric oncology treatment center, which requires comprehensive diagnostic services along with surgical and multidisciplinary specialties to treat the broad spectrum of concerns that children with cancer have. The hospital is staffed by 85 physician specialists in pediatric oncology, surgery, neurosurgery, diagnostics, and orthopedics, with the majority hired full-time to the hospital, thereby ensuring commitment. The spacious 22-clinic outpatient department sees patients who are coming to the clinic for first-time visits, treatment planning, scheduled chemotherapy, symptom management, and off-treatment follow-up. The objective of the day treatment unit is to provide all outpatient treatments such as chemotherapy, hydration, long-term antibiotic therapy, blood products, and minor procedures in an atmosphere that is conducive to wellness and promoting activity, but at the same time provides comfortable loungers and privacy if desired for the long hours of treatment. The principle of pharmaceutical care and clinical pharmacy have been applied in our state-of-the-art department to achieve cost-effective positive outcomes for the patient through patient staff education, close follow-up, and proper preparation, as well as advising the physicians and nurses regarding drug incompatibilities, adverse drug reactions, and new drug information. The objective of the radiology nuclear medicine departments is to provide the best quality imaging information that clinicians require to diagnose and treat the patient. The department is equipped with the most up-to-date versions of CT, MRI, fluoroscopy, ultrasound, angiography, bone scan, and the first PET-CT scan in Egypt. The cyclotron, which produces the radioactive material for the PET-CT, is under construction and will be operational in the next few months. The CCHE laboratories provide all the necessary services to perform the leading-edge cancer diagnostics, such as cytogenetics, immunophenotyping, flow cytometry, and transfusion medicine department that are an integral part of treatment planning and determining outcomes in a timely, cost-effective, and measurable methodology with the highest quality. There is also an on-site blood donor clinic which receives voluntary donations from students, soldiers, police, relatives, staff, and others to ensure that our patients have a safe and plentiful blood supply. The aim of the intensive care unit is to provide comprehensive care to children whose body systems are in an acute state of distress that requires intense observation and monitoring, and 10-bed intermediate care is designed for one-to-one nurse-patient observation, and all patients are in private rooms with a view from the nursing station. The vision of the Psychosocial Oncology Department is to introduce psychological and social care for the child with cancer and his family through a multidisciplinary team approach, so they will find ways to improve quality of life, manage their fears, and find hope for their future. The department, consisting of psychiatrists, psychologists, social workers, and child life therapists, is the first of its kind in Egypt. The 6 operating theaters and 22 stretcher-phased recovery room are state-of-the-art and have all the essential equipment and instrumentation to perform complicated cancer surgery such as microsurgery, laser surgery, and neurosurgery. The rooms are spacious and have the necessary air handling to keep the department infection-free. The nurses are also well trained in the principles of aseptic technique, anatomy and physiology, and surgical nursing. The ultra-modern radiotherapy department has 2 linear accelerators, which are of the latest design and can give the most precise measurements with the least amount of side effects for our children requiring radiation therapy.
كل حاجة في هذه المستشفى على أعلى مستوى عالمي، من المسمار لأكبر أجهزة أشعة لسه ما دخلتش حتى مصر.
The Children's Cancer Hospital Egypt Administration believes firmly that implementation of a volunteer department is necessary to encourage the community to take an active part in CCHE, enabling us to do things creatively, innovatively, and help departments throughout the hospital to achieve the level of service they are striving for. Knowing that you cannot manage what you cannot measure, it is crucial for the hospital to be able to capture all the data about the patients, treatments, expenditures, and all hospital work to be able to develop long-term planning and policies that will affect future expansion or program development. Becoming an automated hospital will not only manage data better, but improve the work of the hospital more efficiently, reduce errors, and be more cost-efficient, as well as being the foundation for future research. CCHE 57357 is a learning organization and has received training grants from external agencies, recognizing that a well-trained staff of all disciplines and levels will not only provide a high level of care in this complex specialty, but will also be a satisfied, loyal, and happy staff. Courses such as infection control, English, and computer literacy are being offered along with individual upgrading such as mini MBAs and clinical skills. Collaborations have begun with other centers such as Dana-Farber Cancer Institute, Children's Hospital of Boston, and St. Jude's Hospital to bring foreign expertise to teach staff as well as sending individuals to these centers for specialized training.
One of the challenges that CCH has is how to expand its services and care to all the children in Egypt. As a start, CCH now is making an affiliation with different cancer centers distributed throughout Egypt to help the pediatric oncology unit in these centers to act and function as a satellites, as a CCH satellites, by offering these units experience and help and treatment protocols. Not only that, but also severely ill patients and those needs intensive therapy or sophisticated type of therapy can start therapy at CCH, then followed up near their homes in their cancer center.
The future strategy is to develop a 57357 Health Sciences Training Academy, focusing on specialization in health information technology, healthcare management, nursing, and other disciplines, with a clinical and theoretical curriculum. Recognizing that research is the key to a better future for our people, space has been allocated to create a research institute focusing on research in the areas of oncology, cancer epidemiology, nursing, pharmacology, healthcare policy, and healthcare management. The fundraising strategy that CCHE implemented 8 years ago was the first Egypt had ever seen. There were several initiatives used to reach all stratas of society, creating a sense of ownership and excitement of change within all Egyptians. The current fundraising strategy is to ensure sustainability by increasing the endowment fund, selling surplus services, developing an aggressive investment strategy, and recruiting loyal donors nationally and internationally who will be committed to CCHE for the long term.
جاي من الشعب المصري، من الأطفال، من شبابه، من القوات المسلحة، من الشرطة، من الشعب البسيط، من تبرع لجنيه لمليون جنيه.
In conclusion, the Children's Cancer Hospital Egypt 57357 is an incredible project that is a true example of the goodness of mankind and what can be achieved when people work together for a common goal. As Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Hospital 57357 will be seen as the watershed that moved healthcare into a new era in the developing world, because it has developed a model that all may follow.